Hello everyone, my name is Amir and today I'm telling you about my athletes for kinesiology 4305. So here is the PARQ questions that we fill out. So the PARQ questions was not was everything clear and she's ready to work out. So for the SMART goal, the specific is like she wants to improve her upper body strength and muscular definition. She was able to do 10 modified push-ups and she wants which is the knee push-ups, and she wants to do 10 stand-up push-ups. Measurable is I will be tracked down how many she will do, and at the end of the 6 week how many regular push-ups that's in happening. And attainable is it is attainable in 6 weeks with 3 to 4 times a week exercises. And relevant, the goal is relevant because she wants to have a stronger upper body, and the time is 6 weeks. Alright, the one of the tests I did was the structural definition using the visual posture assessment, and because of that I saw the slight foot pronation and internal femoral rotation were noted, and also male hip adduction, and there was no other things. And it's normal for soccer players because of a lot of cutting, and I think with some exercises like glute activities like glute bridge or some band stuff, it can help her. And I will inform her that she needs to do exercises if she wants to improve this stuff also. The screen I chose was the shoulder push stabilization, and she showed the mild winging in her left shoulder in the shoulder push. And I chose this because it's related to the push-up goal, where she wants to do 10 regular push-ups at the end of the goal. And the mild scapular ringing on the left reduce the stability and scapular stabilization. To help this issue, we will do Y races or band rows or some exercise that can help her. So I did an assessment of how many push-ups she's gonna be able. So she was able to do 5 regular push-ups, which is 5 left until she reach her goal. And with the ACE IFT model training, I think is possible. And because of I chose phase 1 and 2 to reach our goal. Phase 1 is the week 1 and phase 2 is the following weeks. And in phase 1 we're gonna work on fixing the winging in the left shoulder and some of the other problems, the limitations she had. And the other weeks is the resistance training to increase her strength and power to reach her goal to get to 10 regular push-ups. Lastly, I want to say that my client, I choose the exercises, the bodyweight exercises, which is usually 2 to 3 sets of 8 to 12 and 30 to 60 second rest, and with the control pace or tempo. First exercise we are going to begin our workout is to have more blood flow, is 5 to 10 minutes workout. So and I will tell my client to stay there, and the most important thing is to use the safety belt and to put it here, so we will make sure that she's safe. So for this what we want to do for 5 to 10 minutes walk is that we want to stay not go super hard or not go super low, and basically that's all right. So we don't want to go to such a high speed, and we want to make sure the clients almost hold the handles. And basically the maximum speed I want her to go is 4, just to get the blood flow. The next exercise we are going to do after the training in myofascial release with the tennis ball. So you put the tennis ball on the wall and try to find your shoulder. So basically you try to move the shoulder and stretch it. Make sure it's staying on your shoulder, and great job. Next myofascial release that we are going to do, all the myofascials, they are 30 seconds. So the next one is having the ball and try to do the back and find the pointing and move it. So basically you should move the range of motion and try to stretch your back. Great job. Alright, the next myofascial release for the pecs, and what are we gonna do is just hold your hands and try to stretch your chest, and you hold it for 30 seconds each arm. So and you try to turn your body so there is more stretching on your chest. Do you feel the stretch?
Yeah.
All right, great job. All right, the next exercise is arm circle. This is gonna be forward and backwards, and we want to get the full range of motion, and for 30 seconds forward and 30 seconds backwards. And the goal is like to open up the shoulder and try to get the full range of motion. And the next one is increments, where like the chin should stay to the chest, and we go down and in the line, back and shoulders everywhere in the same place and not too far away from each other. And my client is showing she's going and in the same line, and shoulders don't bend or anything, and the head don't bend, and stay straight, and then come back and try to stretch for 30 seconds. Exercise we are going to do is trunk rotation, so you try to sit on the ground and have like it not too open, not too close, and 90s.
Okay.
Perfect. Yes, make sure it gets 90 degrees and straight both sides. Perfect, and you do that for 30 seconds.
Okay.
Great job. Perfect. The next exercise is we are gonna do is scapular push-ups. That you are gonna try to get in the line, and you're just not gonna do push-ups, and you're just gonna move downward, like basically moving your shoulders.
Yes. Should I do it?
Yes. Perfect. Make sure you stay in the line. Perfect. You can close your arms a little bit also. Yes. Great job. You will do 2 sets of 10, and the next exercise is glute bridge, which you want to lay on the ground and stay like 90 degrees, and just try to bring it up, down, up, down, and you want to do in a controlled phase with a controlled tempo. Yes. Perfect. Down. Great job. And then after doing 2 sets of 2 of glute bridge, you want to open your like hold the band, do 1, 2, you do 2 sets of 10.
Okay.
Perfect. Make sure your elbows stay, and also only your your arms move outside.
Okay.
Yeah, if it's hard, you can just use the one side. You don't need to use 2 sides.
All right.
Perfect. Better. Great job. All right. The first exercise we begin. The exercise is a knee push-ups, where you want to do 3 sets of 9, and between each set you do 30 seconds rest with a control tempo. So you can put a pad or something for like protect your knee, but because we are on carpet, so you basically stay like here, and you try to close your arm, go down, up, and you do want to do control tempo. So like 1, 2, up.
Yeah.
1, 2, up.
Okay.
Perfect. A little bit, yes. Close your, perfect. 1, 2, up. 1, 2, up. This is the knee push-up. Perfect. This is the knee push-up that we want to do, and over the weeks we are going to go until we reach our goal, which is doing 10 modified push-ups. And great job. So we started with a glute bridge for activation. Now it's a real glute bridge. So over the first few weeks is 1 leg glute, 2 legs, and then we are going to get to 1 leg glute bridge. So if you're doing the 2 leg glute bridge, you're gonna put the 2 legs and put your hands, bring it up, 1, 2, 1, 2, 1, and you're gonna do 3 sets of like 7 or 9, depends on how I wrote your schedule, and 30 second rest between.
Okay.
Yeah, with a controlled tempo, that's great. And if you want to do 1 leg, then you like bring one of your legs out, and you try to do that. Yeah. 1, 2, make sure your body stays in a line. Perfect. Yeah, that's great. Good. Next exercise after glute bridge, we are gonna do bird dog. So you can still put a knee pad, and you stay, your back stay straight, and you're in a line like my position. You bring up 1. This is 1. So you wanna do 7 each side.
Okay.
So like this is the one of the examples you're gonna do, and 30 seconds rest it in between each set. Perfect. Make sure you stay in the line. And one more just to make sure you're doing it right. Great. Okay, the next exercise is a side plank. So what we want to do for a side plank, I want you to lay on one side, put your elbow down, and be like this one is, and you bring your one hand up and you try to hold it for 20 seconds each side. And
Okay.
make sure your body is not shaking and you stay in line.
Okay.
So you see, and each side is 20 seconds or depending, and you can have a rest between each set. Perfect. If you put your elbow a little bit more, yeah, that's
That
great.
way?
Yeah, that's great. Arm straight and in line. Great. All right. So if you feel sore or something mid exercise, you can have 1 to 2 sets of front and back that we worked on, like to just release like any
Yeah.
pain or stuff. And after that, we are gonna start our cool down to cool down the body and become ready for the next exercise. Great. Okay, our modifier release is gonna be the same as we did for our warm up. You can use those, and then for PNF, we can do the meal isometric instruction. So one of the exercises I want you to do, I want you to stay to the side of other wall. You put your hand 90 degrees and you try to push your arm outside for 10 seconds. And then you go turn around, you do the other hand, and you can also do for the inside, which you do 10-second push in, and then 10-second push
Yeah.
in.
Okay.
Yeah, make sure it's 90 degrees and push it up. Perfect, 10 seconds, and then you rotate to the other side.
Okay.
Great. All right, then the last one is the static stretches, which is for 30 seconds. So you can do like upwards, to the sides, yeah, and each one you can hold for like 30 seconds, and to this other side. And also what the other things I was thinking, you can do hold it for 30 seconds and the other hand. Perfect. And lastly, what I always try to do is like to hold it back and try to stretch my shoulders.
Yeah.
Perfect. And I like I hope you like my exercises, and I wish it's a helpful thing for everyone.